Assalamu alaikum. I'm Dr. Tooba Mughal, consultant anesthesiologist at Indus Hospital. Today I'm going to talk on the need and necessity of sedation after peripheral nerve block. Okay, so today's outline would be an overview on peripheral nerve blocks, sedation and its types, various factors which necessitate the need for sedation, how to practice sedation after peripheral nerve blocks, and conclusion. So before coming on to the main topic, I would like to tell you what are peripheral nerve blocks. Peripheral nerve blocks are regional anesthesia that it's a type of regional anesthesia that involves injecting local anesthetic around specific nerves to numb targeted areas, providing pain relief and anesthesia. So why do we prefer peripheral nerve blocks over general anesthesia? Recent advances in various surgical techniques and development of more minimally invasive procedures have spurred an increase in outpatient procedures. With these developments, it is necessary that our analgesic techniques should also keep pace with these surgical advancements. So, the studies have shown that peripheral nerve blocks are usually well tolerated when compared to other modalities, and they give regional anesthesia superior to oral medications and general anesthesia, which are associated with more respiratory complications post-operatively and higher incidence of post-op nausea, vomiting, and slower recovery. Now, what is sedation? Sedation refers to technique, medication, and maneuvers performed to help patient tolerate unpleasant and painful procedures, avoiding unwanted memories associated with these procedures. Procedural sedation is intended to result in a depressed level of consciousness that allows the patient to maintain airway and oxygenation more independently. What are types of sedation? Practically used terms in sedation depth are: number one, minimal sedation. Minimal sedation is also called anxiolysis. In this, the patient remains awake but relaxed and able to communicate with the surroundings. Second is moderate sedation. Moderate sedation is also called conscious sedation, in which the patient do have depressed consciousness but will respond to verbal requests or to any stimuli. His breathing is intact and no support is needed in them. The third is deep sedation. In this, the patient cannot be easily aroused but will respond to repeated stimuli or painful stimuli. Breathing may be impaired and support may be needed in these patients. The fourth is the dissociative sedation. In this, there is a trance-like state in which the patient is awake but unaware of his surrounding and pain. He can follow commands and his airway reflexes are intact. Now, coming on to the main topic, that is why sedation is needed after peripheral nerve blocks. So having a surgery is a stressful event in a patient's life. Anxiety is common preoperatively. Common causes of anxiety are fear of surgery, fear of anesthesia, fear of complications associated with anesthesia or surgery, maybe some past unpleasant experience related to surgery or anesthesia, like pain, bleeding, going to ICU, and also having a predisposing part of personality, having anxiety itself. Surgeries under peripheral nerve blocks that numb an area to be operated but patient remains awake can cause distress and anxiety in the patient. So basically it is calming your patient, reducing the stress related to surgery and unfamiliar surrounding, maintaining the stable hemodynamic profile of the patient, and fear of unknown. So many patients may feel more at ease when they are unaware of the surrounding, and that is only possible if they are sedated. If patient is unduly anxious and apprehensive about his procedure, he will have a very bad recovery post-operatively. You may experience increase in heart rate, blood pressure, all due to increase in stress hormones. Fear of unknown, that is uncertainty of the procedure or outcome, and sometimes lack of information regarding procedure also make patient jittery during surgery. Next, sedation improves overall patient experience in the OR. We know that our OT table is not very pleasant. It's very hot, and sometimes there are cold surfaces because of the temperature in the OR. Then the lights, which are quite, enhancing. All of this causes quite discomfort to the patient. So sedation helps to alleviate these problems faced by the patient. Also, sounds of surgical tools like drilling sound and even our own monitors that are continuously beeping in the OR. All of this can increase the anxiety in patient, and this can be ameliorated through sedation. Immobility. So the possibility of patient making risky movements during operation can cause them harm. In procedures involving deeper structures or requiring precision, sedation helps to mobilize the patient and restrict any movement made by them. It ensures that limb remains static and still. All of these factors will reduce the risk of nerve damage which could be caused by limb movement. Procedure complexity and duration. So loss of control for prolonged duration of time may make patient feel vulnerable and helpless. So sedation improves the tolerance of patient undergoing complex or prolonged procedure, which can make them restless and uncooperative. Pain management. Even though peripheral nerve blocks provide pain relief, patient can still feel discomfort. Sedation complements the peripheral nerve block in this regard. Sedation abolishes any residual pain patient experience after peripheral nerve block. This results in enhancing pain management and improving patient satisfaction overall. Optimal surgical requirement. So we know that awake surgeries also raise issues with the surgeon because they need to maintain the balance between the patient's and the staff's need. So I asked one of the surgeons at my hospital regarding his view on this matter. He said that having an awake patient during operation makes him change the way he communicates with his team, because if there is any error or any iatrogenic complication, surgeon can rectify it without patient can listening to them. So by changes, I meant that using code words or limiting the staff in the OR. Also, some surgeons prefer to listen music. So if patient is not sedated, then this could be problematic for the patient. Lastly, surgeon finds it harder to teach his trainees if the patient is awake, because patients don't find it comfortable if any trainee is operating for them. So on a long run, that could be not good for the training program of the hospital. So sedation allows consultants to allow trainees to get hands-on because patients are apprehensive if any junior is operating on them. So in short, sedation is not only making your patient comfortable, but also helps your surgeon to feel at ease while he is operating. Now, best practices for sedation after peripheral nerve block. Number one is individualized patient plan. So every patient is difficult. So you cannot carry out a single plan of sedation for each individual because they have their own comorbidities, their own needs, their own procedural requirements. For that, we need to have a separate plan of sedation for each and every patient. Second is drug. Choice of drug for sedation is very important, and for that, a thorough knowledge of our sedative drugs is very necessary for anesthetists. Mode of action, mechanism, the elimination, dosages, side effects, all of this is a must known fact for anesthetists. Commonly used drugs are benzodiazepines, opioids, and propofol, dexmedetomidine, ketamine. All of this is already discussed in previous lectures. Then comes monitoring. All patients who are having sedation should have standard ASA1 and 2 monitoring, which includes qualified anesthetists, ECG monitoring, blood pressure, pulse oximetry, and end-tidal carbon dioxide. Oxygen supplementation. So we know that our sedative drugs often depress ventilatory drive, which could cause hypoventilation, ultimately causing hypoxemia. So it is a good practice to supplement oxygen via nasal cannula or face mask in these patients. Emergency equipment availability. So adverse events can happen while giving sedation. So again, having emergency drugs and emergency equipments like ETT, LMA, airway devices available in OT, along with that, emergency resuscitation equipments like defibrillator should also be in the nearby premises of the OT. Reversal agents availability. It is a good practice to use only those sedative drugs whose reversible agents are available in your hospital. Lastly, again, sedation requires careful planning, keeping in view patient's clinical and biochemical picture. It should preferably be avoided in critically ill and geriatric patients because there are high chances of causing delirium. Also, it should be avoided in patients with respiratory depression, severe hypotension, cardiac instability, and patients who are already delirious, in pregnant patients and breastfeeding patients. So now I would like to conclude my today's talk by saying that sedation after peripheral nerve block is crucial for optimal patient care. Careful selection and administration of sedatives ensures benefits outweigh the risk. So anesthetists should prioritize sedation as an integral part of peripheral nerve block management. Thank you.